Happy Tuesday, October the 8th, 2019. My name is Angela Hooper-Menifield, and this is your HR moment from Menifield Associates. And so to follow up on yesterday's live or our video, we talked a little bit about how to handle my medical documentation, and specifically like who has a right to it, who needs to see it, how do we file it, and things like that. So if you didn't get a chance to watch the video from Monday, October 7th, I want you to definitely do that. But as a result of yesterday's video, the follow-up question was, okay, so I know where to file the letter or the note, but what exactly is acceptable documentation? So let's talk about a few things that's not acceptable documentation. When an employee is out sick, so for instance, if I worked for someone and I was out sick, bringing a note that just says Angela was sick today is technically not sufficient. Now, a lot of people take it, and I guess the question just becomes, how technical do you want to be with what's required? So typically an acceptable medical excuse document talks about prognosis and diagnosis. Now, what does that mean? Prognosis and diagnosis talks about, either what you can or cannot do, limitations, and the why. So theoretically, let's say I had mono. So, and I picked that, you guys know I watch a lot of sports. So recently the Jets quarterback had mono, right? Technically, we didn't have a right to know that. So our medical note would say something along the lines, excuse me, my hair got in my face. It could say, like, I think one of the side effects for mono is loss of appetite, nausea. I understand there's some concerns with the spleen with mono. So what my doctor could write on my notice says, as a result of being ill, Angela suffers from severe nausea, maybe headaches, sweats, loss of appetite, and even potential, risk, with the spleen thing. But never in the note technically do they have to write that I have mono, because that's a personal thing. That's my PII. What they could also speak to is like, what are my limitations? And as a result of this sickness or these conditions or symptoms, I'm unable to stand for extended period of times, drive, So prognosis and diagnosis. So also, like, how long do you anticipate these medical issues will have me hampered or unable to perform my regular functions? But it is not a requirement that the doctor tell the boss or the office or the organization what my medical condition is, because again, I have a right to privacy. So notes don't have to say things like, Angela has, whatever that is, diabetes, cancer, things like that. So for instance, if I'm taking chemo, and I've had employees that, have been taking chemo, what the doctor could write, because as a result of the treatments that Angela is taking, she is nauseous, unable to eat, and needs bed rest for 8 to 12 hours. But nowhere in that note is that doctor required to say I am actually taking chemo, or that I even have cancer or something like that, right? If that were my medical situation. And so even sometimes I don't think doctors are fully aware of what can and cannot be said. So you get to decide who knows what about your medical condition. So a solid medical note as a supervisor, what we want to know is diagnosis, prognosis. So again, what are the limitations? What are the things the person can or cannot do? Lift, stand extended period of time, or what are the issues? Nausea, required bed rest, things like that. And then how long? What is the anticipated period of time I will be afflicted with this, which then states how long I'll be off work. And or, and if it's something that's extensive, it could be that, this note will be updated every so many days, maybe, every week, every 2 weeks, every 30 days. But your supervisor nor your organization is technically not, they can't mandate that you tell them what your medical situation is. Again, that's your privacy, that's PII. And then there's laws and regulations that are tied to medical privacy. So you don't have to tell people what the actual condition is, but you do owe it to them to say why you can't come to work and what are the medical limitations from whatever the sickness, illness, condition may be that requires you either to need a reasonable accommodation, require for you to be off work, and for what extended period of time. So as a supervisor, again, yesterday we talked a little bit about where do we keep these notes, and this is part of the reason why. Because go back to that analogy of maybe if I'm on chemo, and I even had a friend who had lupus who was doing chemo, that's nobody's business. But if the note is written on letterhead from a, oh my gosh, I just lost my train of thought. But a doctor who treats cancer patients, then people could deduce, right? Like, okay, so if this is this kind of doctor, then must be what the problem is. So now that would be assumptions if it's not in the letter, but that could be the case too. But nonetheless, we do want the letters on official letterhead. I have known supervisors to pick up the phone and call after getting notes. I would say tread very lightly on calling people's doctors because again, this can be viewed as a violation of the privacy that all of us are entitled to as employees. So that's the quick version. Again, we have examples of what that looks like, how to ask for follow-up or get clarity on those kinds of things as supervisors. But again, employees are not required to tell you their medical information. Only, again, prognosis, diagnosis. So this has been Angela Hooper-Menifield with your HR moment for Menifield Associates. And I appreciate, again, all the feedback, the additional questions, the follow-up to help me focus on, what other additional facts to share in this forum. I hope it's adding value to you and you're either making better decisions as the person who has that responsibility, or you're becoming empowered as a person who is being supervised. But either way, knowledge is power, and we want you guys to have accurate knowledge and be able to use it to do the right thing. Most of the bad decisions, that my experience has been anyway, has been a result of good intentions, wrong implementation. So we want to give you accurate information on how to handle things. So prognosis, diagnosis, that's all a medical note has to cover. It needs to be signed and dated, and ideally on official letterhead so that we can verify that it's legitimate. This has been your HR moment with Menifield Associates. Thank you again for watching. I appreciate you guys, and I'll talk to you soon. Bye.